Good evening, class. Today, my group members and I will be presenting on Lyme disease. First and foremost, the causative agents for Lyme disease within the United States is the bacteria Borrelia burgdorferi, whereas in parts of Europe and Asia, the bacterium responsible are Borrelia afzeli and Borrelia burgdorferi. The general morphology of B. burgdorferi is a spherical design with a wave-like body and flagella. The tick-borne obligate parasite takes a blood meal throughout each stage of its life, yet although blood meals of normal hosts do not lead to disease as seen in humans.
The bacteria is carried by ticks of the Ixodes genus. The adult ticks mate and reproduce on a deer. The uninfected larvae hatch on the deer and feed on mice that are infected with the Borrelia bacteria. This is where they become carriers of the pathogen. The next part of development is the nymph stage, which is most infectious to humans because they are smaller and are not easily noticed by the human. The ticks are usually on a shrub and latch onto a human for 2 to 3 days to have the bacteria successfully transfer. Only 1% of tick bites result in disease. Most cases in the U.S. are in the Northeast, as the tick's Ixodes scapularis proliferates there and easily carries the bacteria. On the Pacific coast, the Ixodes pacificus tick feeds on lizards that do not carry the spirochete bacteria as well as the mice do, which results in less transmission to humans.
The first symptom of Lyme disease is usually a rash that appears at the bite site. As seen in the right picture, this rash includes a red area that clears in the center as it expands to a final diameter of about 15 centimeters. This unique rash occurs in about 75% of cases. Flu-like symptoms appear within a couple of weeks as the rash fades. If treatment is not done, the second phase of the disease includes heart problems. The heartbeat may become so irregular that a pacemaker may be required. Chronic neurological symptoms like facial paralysis, oppressive fatigue, and memory loss may be present. Some cases can result in meningitis and encephalitis. The third phase of this disease, which occurs months or years later, includes arthritis, which is caused by an immune response to the presence of this bacteria. Diagnosis of Lyme disease depends on symptoms and the index of suspicion based on the prevalence in the geographic area. Serological tests can be done. Following a positive ELISA or indirect fluorescence antibody test, confirmation should be made with Western blot test.
Treatment for Lyme disease can be differentiated by the stage of the disease. For early stage of Lyme disease, oral treatment of antibiotics is used. Some drugs include doxycycline, amoxicillin, cefuroxime, acetyl. Late stage of the disease usually requires neurological or cardiac treatment. This includes intravenous therapy of drugs such as ceftriaxone or penicillin. Roughly 10 to 20% of patients treated with antibiotics may have persistent or recurring symptoms due to drug resistance. Most patients treated with antibiotics recover after a few weeks. Prevention of Lyme disease primarily involves avoiding areas where ticks can be found, such as woody, bushy, long grass areas. If not possible, try and wear long pants, long sleeves, use insect repellent, check yourself, family members, including pets, for ticks, and if bitten, carefully remove with tweezers to prevent leaving the head attached. Cynthia Ha was covering transmission, Sarah Shams covered symptoms and diagnosis, Eric Tang, me, covered treatment and prevention, and Timmy Yan covered causative agents.